debate, but just to say I want to support Deputy Cullinan's amendment. We're not, as I think Deputy Smith indicated in the second stage debate, we're not supportive of this legislation, and that's not in any way because we're reluctant or reticent about protecting public health. We think it's absolutely critical to protect public health. We are 150% and have been from the beginning for promoting vaccination, and it is clear that vaccination has reduced the likelihood of illness and hospitalisation and death, and at this stage we would strongly encourage people to take up the vaccine. But what is frustrating is the sort of incoherence and often arbitrary and sometimes directionless approach of the government when it comes to dealing with this pandemic at the particular stage that we're at now. And I seriously ask the question at this point, where is the strategy heading? You know, where exactly are we going with this? What is the objective of what we're doing at the moment? And I seriously wonder, and I don't think it's been properly explained, and I think people are right to call out the fact that at the outset of this pandemic we used to have reasonably regular, we had to ask for them, but we used to have reasonably regular briefings with the key ministers and with the public health people, so we could thrash out what was being proposed, what the basis on which decisions were being made, and had opportunities to question those things. That's all gone now, and now we just have the government seeking to have really quite draconian powers without much accountability in terms of the decisions that are being made. And I've got a significant problem with that, particularly because I don't quite know where it's going. And I know that the Taoiseach, for example, today was quick to sort of have little jibes at some of us about, oh, you were for zero COVID and now you're not for this. And I think if for nothing else, I want to explain our rationale on that. Our rationale is very simple. At that stage, we did not have more than 90% of the population vaccinated. We were very keenly aware that...
That's all very interesting. We're supposed to be talking to the amendment.
Yeah, and the amendment is about the need to scrutinise decisions, okay? Is about the need to scrutinise decisions and measures that the minister and powers that the minister wants to give himself in this bill, okay?
Well, has that got anything to do with...
It does, because I am concerned about the lack of a clear rationale for some of the powers that the minister wishes to have. And I want to explain that you need a rationale for a policy and for a strategy. And it's not clear at this point what the rationale is. Because at a particular point in the evolution of this pandemic, everybody believed that there was a possibility that if you got to a certain level of vaccination, and the figure that was being floated at that time was about 70%, or immunity through natural infection, that you'd reach a point where the R number of COVID-19 would start to go into decline. Essentially, it would go below 1, and you'd be faced with you could seriously consider the possibility that the disease would fizzle out. Okay, that was the belief at the time. We've now discovered that that is not the case. That even with 95%, a figure that nobody ever dreamed possible, that we are not looking at the possibility of this virus disappearing.
How do you relate all that to Amendment 20?
Because you do not give powers to the minister without lack of accountability to this House unless you know where the strategy is heading.
I have to say I admire your ingenuity,
Yeah.
Deputy Boyd Barrett.
Draconian powers without knowing where it is all heading. And in particular, when the government isn't giving clear answers, because I'll tell you what is consistent in our particular approach to this, is when we were campaigning for elimination as a strategy prior to there being mass vaccination. The whole point was to reduce the likelihood of long, protracted periods of very harsh restrictions, okay, of rolling lockdowns and so on that went on for long periods of time, precisely because we saw it as a mechanism to reopen society. Okay, now the question is, and that's what everybody wants. How do we reopen society but do it safely in a way that we can cope with COVID-19 and protect lives and protect health? And what I don't understand in that regard, for example, is the reluctance, unwillingness to even have a serious discussion about the issue of air quality and ventilation and so on. But the government is very quick to give itself certain powers, quite draconian powers, without a clear rationale of where it's heading. And I'd like to hear from the Minister where he thinks it's all heading in terms of how we're going to sort of get back to some level of normality and how these powers are designed to achieve that.
How you're going to get back to the amendments that we're debating.
Okay, very clearly. I do not believe in giving wide-ranging powers to the Minister without accountability to this House unless he can give us an evidence-based argument that is convincing, and indeed the wider public out there, about what exactly the purpose of all of this is and how it's part of an integrated strategy to cope with COVID-19. And I think that is distinctly lacking. And what we end up with then is a government essentially looking around to point the finger at other people, particular groups, incoherent messages about where is the real problem, rather than take responsibility itself for the things it could do and should do in order to cope with COVID-19. And I think that's political. It's a political exercise rather than an exercise in trying to find the best way to cope with this extremely difficult situation. So that is the reason we will be opposing it, and why, at the very least, I think the amendment that Deputy Cullinan is putting forward here is a way of insisting that there's some level of accountability and that the Minister doesn't get a blank cheque when he really is not convincing people about where all this is going, and, in our view, are failing dramatically, spectacularly, to take measures that it seems to us are a no-brainer in terms of developing our capacity to cope with this situation. Whether it's air ventilation, whether it's having targets to get our ICU up to the levels it should be, whether it's staffing and resourcing our public health teams, whether it's maintaining on a permanent basis the health and infrastructure, the health capacity and resources and infrastructure that we need to cope with COVID-19. On all of those fronts, we think the government is failing, but it is quite quick to give itself power, if you like, to take draconian measures that essentially point the finger at others rather than the government itself in terms of responsibility to do the things necessary to cope with the pandemic.